Flat back syndrome, 5 warning signs you should not ignore. You might think it's just stiffness or bad posture, but if you're dealing with these 5 signs, your spine could be going through something more serious, something called flat back syndrome. It starts with the straightening of the lumbar spine, and once that natural curve disappears, it puts intense pressure on the discs, joints, and nerves. If you don't fix it, it leads to chronic back pain, sciatica or leg pain, and sometimes even surgery. But if you catch it early, you can fix this naturally. No drugs, no shots. And the third sign that I see in nearly every patient who ends up needing aggressive care. Aggressive care would be something like a shot or a surgery. You want to avoid that. I want to avoid that, so don't miss it. I'm Dr. Gregory Kramer. I have over 33 years of clinical experience and advanced certification in chiropractic biophysics. Biophysics is the leading corrective care technique in the non-drug, non-surgical management field. I specialize in treating chronic problems, particularly chronic L4, L5 disc problems, chronic neuropathy, that's pain in your feet, chronic whiplash, that's where you tear the ligaments in your neck, chronic knee problems, and a host of other conditions. I utilize a variety of non-surgical corrective methods, particularly targeted exercises, mirror image adjustments, and mirror image corrective traction, along with decompression. Decompression takes pressure off the joints, the disc, and the nerve. And so if you want to eliminate pain, avoid surgery so that you can live stronger longer, watch this video. Also, hit the subscribe button because you're going to learn always information on how to help yourself so that you can live stronger longer. What is flat back syndrome? So if you've looked at your MRI or an x-ray report, if you've been told your spine looks straight from the side on an x-ray, or standing up straight just feels uncomfortable, you feel like you don't feel like you can stand tall, there's a good chance you're dealing with flat back syndrome. That's when the natural curve in your lower back flattens out or disappears completely. This condition, also called straightening the lumbar spine, doesn't always start with intense pain. And just like most health problems, almost never does it start with intense pain. It starts with small, little subtle warnings that are easy to overlook. But if you catch them early, you can correct it without surgery and without relying on dangerous painkillers or endless stretching routine. So let's go through the 5 red flag symptoms that can mean your spine is losing its curve. The number 1 sign is difficulty standing upright. So one of the first warning signs we often see is that it feels hard to stand up straight, or it takes effort to hold yourself upright for more than a minute or 2. You might notice that your shoulders start to drift forward, or your hips feel tight, or your whole body leans slightly ahead of center of gravity. So what that means is instead of standing up tall, you're kind of hunched, or if we look at you from the side, you are bent forward. This happens because when your lumbar spine starts to straighten out, your posture collapses forward and your body begins compensating in that way that feels normal until it's not. Now, the number 2 sign is morning stiffness in the lower back. So if you wake up every morning and you feel stiff, like it takes you a few minutes just to loosen up, just to stand up straight, it's not just age catching up to you. There's something structurally wrong. Straightening of the lumbar spine limits the natural spring and movement your spine needs to decompress overnight. That stiffness is often the easiest signal that your spine is locking down, and flat back syndrome may be forming beneath the surface. Now, number 3, back pain during a basic activity. If simple things like standing, walking, or lifting even light objects consistently trigger your back, especially in the lower back, it could be a red flag that your spine has lost its natural curve. So if you lose the curve, if your spine is flat, it doesn't absorb shock. So that means there's more pressure on the discs and the joints, and the more inflammation, there's more irritation to those nearby nerves. In my experience, the specific sign shows up on every person I've worked with who had advanced flat back syndrome. That means you have pain during little activities. Now, keep watching to the end because I'm going to show you one of the best non-surgical corrective care techniques we use in practice to actually improve, in many cases, completely correct flat back syndrome without drugs, injections, or surgery. So, the 4th sign, forward head posture. When the lumbar spine flattens, the upper body tends to drift forward. That causes a chain reaction all the way through the mid-back, shoulders, and neck. You might notice that your head is jutting forward. Your shoulders are starting to round like this, even when you sit or try to stand up straight. This is one of the hidden signs of flat back syndrome that often gets overlooked because it shows up as neck tension, headaches, or poor posture. But the root cause, the root issue, is usually down lower and straightening of the lumbar spine. Now, the fifth and last sign is exercise and stretching don't help. You've tried stretching, you've done yoga, maybe even some core work, but that back pain keeps coming back, or nothing really changes. That's a sign that you're working on the symptoms but not the structure. So if you had a muscular problem, those things would take care of it. But if you have a structural problem, a problem with the disc and the joints, that lumbar spine is flattened, generic rehab routines are not enough. What you need is a corrective approach that targets, that's specific to the actual cause of the lumbar curve, not just the muscles around it. Now, the non-surgical technique that can help. Now, earlier on, I promised to share one of the most effective non-surgical corrective care techniques that help improve, in many cases, correct flat back syndrome. It's called chiropractic biophysics, or CBP, which is a advanced corrective care technique, and I'm certified in that technique. So CBP is a research-backed technique with over 360 research publications. It's designed to restore the natural spinal curves that have been lost, especially in cases of straightening of the lumbar spine. CBP works through a three-part process. We often like to use the acronym EAT, E-A-T, or exercise, adjustments, and traction. And we use the word mirror image exercise. That's the opposite of what your posture is. So a mirror image exercise retrains your posture muscles by moving your body in the exact opposite direction of the distortion. Mirror image adjustments, specific spinal adjustments that realign the vertebrae using advanced geometry-based positioning. And then there's mirror image traction. This is the game changer. It gently elongates and reshapes the spine to rebuild the lumbar curve over time. So think of exercise for the muscles, think of adjustments for the spine and the nervous system, and think of traction for the ligaments. Ligaments hold you in alignment. Now, if you want to see what that looks like, I've made many separate videos that will walk you through each of these. You'll find the links in the description below. This is the approach we use every day in our practice to help patients avoid surgery and correct flat back syndrome at the structural level, not just mask the symptoms. So if you've been told there's nothing you can do or that surgery is your only option, I want you to know that's not true. You've probably been through physical therapy. You've probably done yoga. You've probably been to a physiatrist. You might have had some shots, and you might have had what we call general manipulation by a chiropractor. However, that's not enough. You need specific, targeted corrective care based on an x-ray of you. So again, many times you can find an answer that's non-drug and non-surgical. Flat back syndrome can be corrected or improved. Even if your spine is already starting to strain, there are proven non-surgical options that can help, like chiropractic biophysics. So you're not stuck, you're not broken, and you don't have to live in pain forever. So if you found this video helpful or eye-opening, do me a favor, like it and share it with someone who needs to hear this. And if you want to learn how to rebuild your spine, restore your posture, and avoid surgery the natural way, do me a favor, subscribe, because I share videos that walk you through every step of the process. Now, the next video you need to watch is this one right here. It's going to show you the exact corrective adjustments we use in practice to restore the lumbar curve. Click it now, and I'll see you there.